Good morning. Political Polly here. I'm hearing a lot about not my president's new healthcare plan, and I hear a lot of the haters against the healthcare plan, and they're talking about things like, oh my God, what's going to happen to Medicaid? Or if you can afford an iPhone, you can afford health insurance. Here's the problem. And I used to feel like this. I used to be one of these people that said, oh, these people who go on fancy vacations, but they say they can't afford health insurance, they're lying. They're not prioritizing properly. They don't care about their health. And then I became one of these people. Here's the problem. Yes, I can afford both an iPhone and a health insurance plan. The problem is I can use the iPhone. I can use it. I will use it every day. I cannot use the health insurance because the deductibles are too high and the copays are too high. And as I have said before on this very forum, I can afford to be diagnosed with an illness, but I can't afford to be treated for it because that's all out of pocket and the deductibles are so high. Not to mention the fact that as a healthy smoker, I am already discriminated against in my premiums. My premiums are 50% more than a non-smoker's. Even though I have never had any health issues, I've never been to an ER in my life. I have not been to a doctor for an ill visit in almost 30 years. I'm not on any prescription medication. I'm 52 years old. I have no chronic illnesses that I know of because, again, I don't go to the doctor. Maybe that's why I have no chronic illnesses. Like car inspection, there's always something wrong. Yeah, I try to stay away from the doctor because you know what? I feel fine. And I don't want to know. I don't want to know that I have a disease that I can't afford to cure or that I choose not to cure because the treatment is worse than the disease itself, like cancer. I know people with cancer who are going through a lot right now, and I couldn't live with that. So I would choose to be like, okay, let's just see what happens. I don't love life so much that I am willing to lose my life, my lifestyle, to live forever. That's my one thing. Of course, I want to live to be old. I want to live to see what's coming next, what's new in technology, what's new in the movies, what new books come out. I want to live. Believe me, I'm not suicidal. But I don't want to live where every day of my life is spent worrying about, is today the day the cancer comes back, or I'm going to be sick all the time because of treatment that I'm getting for something. I won't be able to be around loved ones because they might have a cold or a sniffle. I certainly don't want to lose this. And that makes me sound very, very shallow. But when I die, I will be buried with this hair on my head. I don't want poisons going into my body. Yes, I smoke, and people will say, well, that's poison. But that's not going to make me lose my lifestyle. It's not. So this new healthcare plan, one thing I do like about it is I took a gamble this year, which most of you know is I decided to go without insurance. And people were like, oh, you're going to get penalized. Well, thank you, not my President Trump. Now I won't. If this thing passes, there is no more mandate. So I will not. I gambled and I won. I won't have to pay a penalty for refusing to pay $800 a month for insurance that I will never use because the deductible is so high and the copays are so high that even if I got sick, I still won't. I'll be out. The insurance company wins, I lose. That's the way it always is. So I gambled. And guess what? I think I won if this thing goes through. But here's what I can't stand hearing. What about the poor people? Well, what about the poor people? People who are refusing, able-bodied people who refuse to get jobs because they have small children to take care of and being a parent is a disability and we can't afford health insurance, so we want the taxpayers to pay for it for us. What about them? fucking job. Like my husband. Like I did when I worked 3 jobs when my husband and I were poor to afford to pay our bills and feed ourselves and take care of ourselves and pay our medical bills. Go get a job. You are not entitled for me and my husband to pay triple the premium for the same policy that you're getting for free because you don't want to go out and get a job. Oh my God. Hell, you already get your damn iPhones for free because it's a necessity. Get a job. Nobody owes you health care on my money. I don't owe you health care. Maybe your government does, and that's a whole different subject. But if your government's going to give you health insurance, then they're sure as hell going to give me and my husband health insurance too. And yeah, Mika Brzezinski over at Morning Joe just got called emotional. I'm emotional about this because I am sick and freaking tired of paying for people who are perfectly able to have a job who just don't want one. But then they want to be able to go to the ER and go to the doctor and take their kids to the doctor whenever they don't feel good. Get over yourself. Do you know how many days a year I don't feel good? I don't run to no doctor. I have a shot of Sambuca and smoke a pack of cigarettes. I feel better. I don't pay no doctor to tell me, ooh, maybe you should quit smoking or quit drinking. Oh, screw that. I don't pay a doctor to want to stick a tube down my throat to tell me I have acid reflux. I know I have acid reflux, and I know how to take care of it. I don't run to the doctor when I have a sore throat or a sniffle or a headache. I don't go to the ER when I cut my finger. I stitch it up myself in my kitchen. So yeah, I don't need health insurance for that. What I need health insurance for is, God forbid, I need major surgery or I get in a car accident and I have to have my leg operated on because I broke my leg. I need health insurance for those things that may never happen but might happen, and I should not be paying $15,000 a year for that health insurance because it's never going to happen. And when it does happen, it'll happen once and it'll never happen again. So all this crap about what about the poor people? Well, what about the people who aren't poor but are middle class, who are paying for the poor people to get all this free crap while the poor people sit on their sofas and watch their free cable TV, play around with Candy Crush Saga and all their freaking video games on their free cell phones? How about them? How about tell them to go out and get a job? Because, yeah, I can afford an iPhone. I can also afford that health insurance policy that I refuse to get. I can afford to pay for it. But I'm not going to use it. Because I won't be able to afford to use it. That's the problem. And I'm not going to pay for any product, and health insurance is a product, and I am a consumer. I'm not going to pay for something that is going to go out of their way to not allow me to use it. They're going to find a loophole. Well, that isn't exactly covered. And that isn't covered 100%, and you have to pay so much out of pocket, blah, blah, blah. You buy an iPhone, you use the iPhone. They don't tell you you got to spend $7,500 out of pocket before you can use your iPhone, before you can turn it on. Insurance companies tell you that. I can't turn my insurance on until I spend $7,500 on top of my premium out of pocket. So that's $15,000 a year I have to spend before my insurance actually works. And that's a lot of money when you're healthy, like I am. And what about all these sick people who never bothered to get insurance before, who said, well, I just got diagnosed with some serious cancer, I better get me some insurance. And before they even pay their first premium, they already racked up $10,000 in 1 month in bills that the insurance company has to pay for. That isn't right either. That's not right. So I don't know what the answers are. But I know that if all we're going to worry about is who's going to get free health insurance instead of the people who go to a job every day and work hard and are getting screwed because we're being forced to pay for the people who refuse to go out and work and they're getting the free shit, that's not right either. And this year I took my stand. I made my stand. I refuse to participate in a program like that. Not one dime of my money, well, other than my taxes, of course, which always go to people who refuse to work, to eat, have a house, all the stuff they get for free. But I refuse to pay for health insurance for people who could go out and get a job and pay for their own. That's just the way I roll. I want to take care of me and my family. And everybody else should have the personal responsibility in their hearts and in their brains to take care of their family. You choose to have children, you pay to take care of them. You pay for their health care. You pay for their food, and you pay for their housing. And if you can't, then you use that damn birth control that your free medical insurance pays for. Use the birth control. Don't have these kids and then ask me and my husband to pay for them. Because we're done. I'm done. That's why I am out of the health insurance lottery, where you basically, it's like playing Vegas. You gamble. I gamble. And right now I'm winning. Because I just saved $15,000 this year by not playing their game. I can buy 10 iPhones, which, by the way, I will be able to use the first day I get them. I won't have to wait till I get chronically ill or get cancer to turn on the iPhone. The iPhone works the day you get it. That's how insurance should work too. Political Paula, out.